The Evergreen Media Network Studio, powered by Scott Tree Services.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. Each week, I come on to this show with a different guest so that we can talk about things that are current, that are interesting, and usually in some fashion connected to health, although not always. Today's connection is through transportation, because if we didn't have great transportation in this community, I know it would be much harder for individuals to see their physicians, their dentists, even to get to the emergency room at times. And so I welcome Karen Diegl, the CEO of the Senior Resource Association, who is also in charge of transportation through the GoLine and Community Coach in Indian River County. So welcome, Karen.
Thank you.
I've got some interesting rumors floating around, which is why I invited you, and that is that the GoLine hours are going to expand.
Well, they actually have expanded already.
Oh.
Yes, it started last Monday.
That's a problem with rumors.
Yeah,
Sometimes
there you go.
They take
so
a while.
The rumor is true. It's the truth. It's not just a rumor. Yeah. So we expanded our hours Monday through Friday. We were running until only 7 p.m. at night. Mm-hmm. Now we're running till 9 p.m. at night.
Wow.
And I'm so pleased to say that it is already successful. We've been looking at the numbers and comparing between 5 and 7 at night and seeing if those numbers dropped. Mm-hmm. And they have not. And we have been doing about roughly around 130 to 160 additional trips between 7 and 9 at night now. So people are aware of it, and they're using it.
That's fantastic. I know that has limited our tradition of staying open later because when people get there, then they don't know how they're going to get home from our health centers. And as we see the sun setting later, I wonder about the traffic off of the beach as well.
Yeah, that's, it's kind of interesting. And we're also tracking where the traffic is going and what routes are using it more, and this is definitely work. People coming home from work or medical care.
Okay, and in the fall, I'm expecting you'll see more ridership then from the colleges.
I would expect
they can
so too.
Sign up for later classes.
They can. That's correct. Yeah, I never thought of that, but yes, you're right. That would be definitely something that will
That's
be happening.
Fantastic.
So. And we're also going to be on Saturdays. We will be expanding hours from 8 a.m. to 7 p.m. Okay. It'll probably happen within the next 2 months. Right now, we're running 8 to 5 on Saturdays. Mm-hmm. And the other route, which we have included on Saturdays, and that has started, is the Route 13, which runs from the Vero Beach Mall to the outlet. So it runs up 60. We didn't run that route on Saturdays. And so the funding that we received enabled us to do that as well.
So people can go out to shop and to eat.
That's right.
Till a later time.
That's right. Or, on Saturdays, I don't know if there's a few places out there. I know Carol Jean Jordan has her, and I don't know if they're open on Saturdays or not. But
I'm
yeah,
not sure, but it gives all of us that opportunity to say what makes it more convenient for our customers,
That's
for
right.
our clients, for our patients.
Which is the whole idea with transportation. And we're really thankful that, so kind of how all this comes about, just to kind of go about or back up a little bit. We have to do a transit development plan every 5 years.
Okay.
And we re-up it every year. The last major one just happened, and it was approved by the Metropolitan Planning Organization in September, and then it's taken to the Board of County Commissioners after that. The plan is kind of our Bible of what we should be doing next. And this was the 3 top items requested by our community, our riders, our community, is to expand the hours, Saturdays, weekdays. And so it was pretty awesome because, usually, as you know, you always have to fight for money.
Yep.
And at the MPO meeting, we had one of the commissioners speak up and say, "Hey, why wait? Why not? Let's fund this. This is important."
Oh, nice.
And it was unanimous around the room to do it. So as long as we could find the money from the state, the county would then match it. And as soon as that meeting was over, I got on the phone to FDOT and said, "Hey, do you have any extra money hanging around somewhere?" And sure enough, actually, they were able to find some dollars to help us out. And
Fantastic.
so we're real excited
Well,
about
and
this.
you've been doing this, you and Senior Resource Association, for many years. I saw in one of your materials since 1990.
1990, we've been doing the mass transit. We actually started with previous to that, we were doing the door-to-door or the smaller door-to-door because, and remember, Senior Resource Association, 50 years. We've been providing services in this year's 50 years. So initially, the transit started as bringing people to adult daycare or the senior center or for
all senior related.
Senior related, exactly. And it was the smaller vans, the community coach.
Right.
And then at one point, when the population gets to a certain level in a county, they are required to have a fixed route. Now, does that mean it has to be explosive? No, it could be, one going northwest or north-south, east-west. And that's kind of how it started. The county said, "Hey, listen, you're already doing transit. Would you consider doing some fixed routes for us?" And that's when 1990 started. And when I took over in 2006, I think it was about five routes then, something like 5
Sounds
or 7.
about right. Yeah.
And I just have a passion for it, for transit. I think it's really important, quality of life, giving people quality of life. And we have really built up the system in the community to be an award-winning system.
Absolutely. You listen to the individuals that use it. And so I've seen the routes change. I've seen the racks go on the front of the buses for people who need to have transportation to the stop, after the
first and
stop.
last mile.
Yeah.
Yeah.
And so that's been fantastic. Certainly seeing the integration as we get more technology oriented of putting wheelchair riders on and those types of things in the bigger buses.
Yeah.
It's been fantastic.
All our buses are equipped for ADA. They can all our buses manage wheelchair
and they're all
accessibility.
free, which is
no
fantastic.
fare. No fare.
Sorry.
That's okay. I always say no fare because as
That's
I said,
right.
Nothing is free.
Nothing is free in life.
But
That's
we
what
do have
somebody's
no
paying.
fare on the fixed route. There is a copay, a small copay of $2 for the community coach in some cases, depending
That
on
makes sense.
their eligibility. But yeah, so it is a wonderful way for individuals to get around. I think to own a car is roughly, I think it's around $13,000 or $14,000 a year. It costs
Between
to
maintenance
drive.
and gas and insurance.
That's
and
right.
Wow.
Yeah, so we're saving individuals
And
those
if you've got a
dollars.
teenager in the house, that's just the
That's right.
beginning.
And it was kind of interesting. Back in November, we do Dump the Pump week. And I actually dumped my car that week and I rode it to work, and I got my bike out because of course I'm about 1.5 miles from the nearest bus stop from where I live. And so yeah, I rode my bike, put the bike on the rack and got on and went up to Sebastian.
I was just going to ask if you worked from home the other 3 days.
No. I had meetings all over and had to carefully coordinate. Of course, it is not, of course, maybe as convenient as getting in your car and zipping off, but it's doable. It's very doable. And
well, and the other thing that I noticed is you have really made an effort to get more bus stops, shelters. Between the rain and the sunshine, that's probably the hardest part of the transportation is waiting.
Over 500 bus stops in Indian River County. And
how you have grown.
oh yeah. And we now have, oh my gosh, I think it's 60 bus stops. And we just finished doing an RFP for a new contractor to install more. So we have 15 that are already slated to go up in the next few months.
That's amazing. That is.
The other program that we're doing with, well, we're looking into this, and this is kind of interesting. It's a van pool. So for individuals who are working somewhere and there's a group of individuals, 4 or greater, and they would share, there's a cost that either the employer picks up or themselves that pick up. But it's a program through FDOT, and it's a van that is used by those individuals to get to and from work. You have a designated driver. And
This must sound awfully familiar to people that live in the Northeast.
yeah, probably. It's quite, yeah. So we're actually, there's a citrus farm that has individuals that live in St. Lucie County. And so because we're bringing them into Indian River County to work, we are going to start to organize this van pool that they can share a van and get to and from work. It's a great program. So if there's any companies that have that kind of an issue with their employees, please give me a call. We're starting to build on that.
You know, in Michigan, we would see next to the expressways a lot by almost every exit. A van share parking lot,
right?
You know, where you would park there, you'd meet your fellow drivers and drive.
Away they go.
Away they go.
That's right.
Exactly.
Yeah. So that's what
That's very interesting. So again, the cost would be.
So we're working on that right now because it's through FDOT and actually Enterprise, and it's very minimal. I think it's something like $400 or $500 a month, but it's shared by everyone. And a lot of times, as I say, the company actually picks that up.
Well, even if it were $100 to $200 a month compared to $1,000 plus every month in your own vehicle, that's huge. So very good.
Yeah.
Always moving ahead, aren't you, Ms.
Trying
Diegl?
new different things. Thank you.
So I do want to ask one thing before we leave transportation, though, and that is about the community coach.
Yes.
The hours on that have stayed the same?
No, the hours, when you expand, the hours on the community coach have also expanded.
Oh, wonderful.
So, yeah, we fit it in. So our offices are now open, same hours as what we're running community coach. It will run. So we're running from 6 a.m. to 9 p.m. Monday through Friday, 8 a.m. to 5 p.m. on Saturday currently, hoping in the next month or so to go to 7 p.m. And that would be for both systems, both the GoLine and community coach.
So the only thing you haven't gotten covered is Sunday. That'll be your next.
That is looked at. We did Sunday community coach services back in, I think it was pre-COVID. This is when we had a shuttle running on Sundays on the beach. That was a private partnership, private-public partnership, and to try and help with the parking crisis. So when you're operating, and that was considered a fixed route, when you're operating a fixed route, you have to operate the community coach as well. You're required to. So we did do Sunday services, and it was funny. There wasn't a lot of demand for community coach. There certainly would be demand for the fixed route, and that will be something that we
look at again.
Yeah, but it would be the fixed route that I know that would be used more than community coach. Yeah.
Well, that's all really great information. And again, my thanks to you for continuing to lead that. It's no small venture. I hear about the number of meetings that you have to have, both internally in the county as well as statewide and trips to Tallahassee and all of that. And the fact that it is definitely affordable and definitely convenient. One last question, though. How hard is it to change routes?
So our system is built on a spoke and wheel system. So you move, if you're wanting to, say, go from Fellsmere to the Intergenerational Center out in Oslo, you would take your bus from Fellsmere to the main, or to the North County hub. So that's a half hour. Okay. And then from the hub to the mall, which is another half hour, and then one other bus to go out to the IG, and that would be another half hour. So take you an hour and a half. But the idea is the connections through our hubs, and there's 5 different hubs in the community.
So the short answer is don't mess with the system because they're all interconnected.
They're all interconnected. We have a Google site that you can actually, on Google Maps, you can just put in when you see the bus, instead of there's car, walking, bus, press bus on a Google map, and it will help you do the connections. We also have a, on our website, there's also a live, you can see where the buses are live.
And you have a limit in terms of unescorted minors?
So, yes, 12 years of age and older, 12 years of age and younger have to be accompanied by an adult.
That's pretty typical.
Yeah.
Okay. So thank you so much for that information. Let's switch gears to your main business.
Well, not so main. Everybody has its place. Everything's main.
Well, when we think of Senior Resource Association, we really do think about the number of support services, not the least of which is probably your oldest service, and that's the day away care.
The day away care. Okay. So yeah, day away care is for individuals who can no longer be left at home by themselves.
You know what? I should have said something. We need to take a break from our sponsors.
Okay.
I'm so sorry to interrupt. That was lousy timing on my part. It's just so wonderful talking to you. Hang tight. We'll be back in a few minutes. Listen to all of the wonderful sponsor information we have for you. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs in all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Bollywood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Family owned and operated since 1991. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. Visit our website at sunshinefurniturecasual.com.
Sunshine Furniture, the best in every way. Ooh, have a sunshine day. Sunshine.
And welcome back to Community Conversations. If you're just joining, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, where we provide primary care, whether you need medical, dental, behavioral health, or mental health services. We have an in-house pharmacy. We have x-rays. Basically, it's a one-stop shop for as many services as you might be able to utilize for your convenience at 8 different locations around town. But this week we have Karen Diegl here, and she's been talking to us about how we get to all the different services that we need in the county, and it is at
Zero fare.
Zero fare. I almost said free. I knew that wasn't right. Zero
no fare. Or zero fare.
Yes. And expanded routes, which is wonderful. Yeah. So thank you again very much for that. We shifted gears just before our break to senior adult daycare.
Our day away program.
And that's still going very strong, I presume.
It is. Well, it's going very strong. It's for individuals who cannot be left at home. They have, it's, cognitively or physically, the disability, whereas they are unable to be left at home by themselves. Most of our clients have some form of dementia. It runs 5 days a week. We have 2 different locations, one in Vero, one in Sebastian. 7:30 to 5:30 are the hours. Individuals do not have to come that entire time. That's the nice thing about it. They can come, few hours every day, a few hours every other day, or whatever.
So it's a relief
works
for
their...
caregivers?
Well, that's the interesting. So it's the person attending is getting a lot of love, care,
Stimulation.
It is so good for those individuals. However, the caregiver, which is in some cases more important, they have the respite time, so they can go to work. A lot of our caregivers do still work because they're taking care of their parents or their spouse. They can go to appointments. I even say they can just sit home and stare at the wall because they just need to. Yeah. And so this program, it's wonderful for individuals who we keep them active. We've got a lot of activities. We have a lot of partners for those activities. Museum of Art come in and do a wonderful art program.
Oh, nice.
Dogs for Life, of course, bring their furry friends in. We have music, Hobo Jim, who is a DJ. He comes a couple times a week and they dance. And every day starts off with current affairs, exercising. Hot meals are provided, family style, and just a loving, caring environment. It is a healthcare facility. When I say that, we are licensed by ACA, so all of our employees are certified nurses.
So they can give out medications. They can give out
needed. Medications as well. Person coming in needs to be weight bearing. They can be in a wheelchair, but they need to be able to
lift themselves and transfer.
To transfer, okay. Exactly.
Okay.
Incontinence is not a problem, and it's just a wonderful program for the community.
I bet you have most people there most days, don't you?
A lot of them do come.
Neighborhood.
A lot of them do come. I'll tell you what happened during COVID. Of course, our numbers obviously we had to close down during COVID,
right.
So it's been a slow growth in the last few years.
Such a wonderful service, though. I know when I was a caregiver for my parents, I loved doing it, but there were just some times where they would say, "Oh, we'll be fine. We'll look after each other." And I would run through the grocery store because I was worried about leaving them alone.
That's right.
Yeah.
So
that's a wonderful service. And again, if someone was interested, how would they find out more?
So just call us 772-569-0960. Oh my gosh.
Or look up SRA.
Look up SRA or seniorresourceassociation.org is our website. And that gives you everything you need to know about us.
Yeah, there's a lot of great programs that we didn't have time to go into today. Meals on Wheels.
Meals on Wheels. We have case managed, like in-home services, durable medical equipment. If you're ever needing any type of durable medical equipment, walkers, wheelchairs, canes, crutches, we have a loaning program.
What a relief, because they're so expensive. They take time to come in. You go to the thrift shops, and if you're lucky, you could find something, but more often than not, you can't.
And so we provide that. In conjunction with the Senior Collaborative, we do information referral. A lot of the calls that we get that are not good for us, we send over to the Senior Collaborative to be able to help people.
Yeah, they're a whole encyclopedia of 700 different
oh my gosh, absolutely.
For-profit, nonprofit, resource-related things. So thank you again for being on our show, Karen.
Thank you for having me.
Yeah, anytime. And thank you for being a listening audience of wonderfulness. Without you, I'd just be doing something else and not speaking to all these wonderful people that give of their time to our community as well. So I wish you a happy evening, and we'll talk next week. Good night.